Hello there, my name is Thomas Van der Sloot and I'm a fourth year neuroscience student here at the University of British Columbia. I was really lucky to have two amazing co-op placements that span from healthcare strategy as well as neuroscience research. And in my free time, I love getting active and exploring the nature that Vancouver has to offer. It feels totally surreal. I mean, when you're in the thick of things, managing the lab and planning experiments, it's not something that really even crosses your mind, but I'm really happy to know that, the co-op program and my PI, Dr. Mark Cembrowski, and my lab mates, they all kind of trusted in my work to put this forward for the nomination. And I think it just goes to show that you should seize the opportunities available to you, because I didn't even know that this was a possibility at the beginning of my co-op, but it's a huge honor and I'm super happy and grateful to receive it. Yeah, so my first placement was over in Calgary, Alberta, working with Satori Health Network. With them, I was their strategic research lead, so I was analyzing international healthcare systems, and I was putting forth initiatives such as a remote patient monitoring program, as well as a cost-effectiveness study for their patient health network. And then in my current role, I work with the Cembrowski lab here at UBC. And it's kind of a two-sided role. On the one hand, I'm managing the lab, doing the finances, animal colonies, all the reporting. And on the other hand, I'm also leading my own independent project on Alzheimer's disease research. I would say one thing I've really enjoyed about the role is just the freedom, being able to plan my own experiments, put forth my own hypotheses and test them. It's been really valuable. But honestly, the most important thing to me has been freeing up the time for the graduate students to be able to focus on their research by kind of streamlining all the other systems in the lab and the work I do behind the scenes to, contribute to our greater productivity here in the lab. I think one big thing that I learned from my experiences was definitely confidence. With Satori Health Network, I was just a student in a boardroom full of executives, and I had to trust in my own analysis that I had done and the initiatives that I had proposed. And in the end, even though I had some doubts in myself, the executive team really liked the initiatives that I put forth, and it was really meaningful to be able to contribute to the direction of a company just being a student, and I gained a lot of confidence from that. And then at the Cembrowski lab, I think one thing that I brought to the team was just a willingness to be open, to be able to contribute to a bunch of different projects, from clinical stuff to the research I'm doing on Alzheimer's disease, and overall I try to be a glue that, keeps the operations running smoothly for the lab and brings everything together. I think that this experience has really solidified my future professional goals. I've had a long-standing interest in going into medicine, and having the chance to work at Satori doing this systems level strategy, I got to see how these macro changes can lead to changes in patients' daily lives, and that was really meaningful. And my work here in the Cembrowski lab has been absolutely amazing, being able to contribute to Alzheimer's disease research. I know it's a disease that affects so many millions of people worldwide, and I have personally family with the disease as well, so it's really meaningful to me. And tying these two experiences together, I want to be a physician who can serve underserved communities here in BC, stay involved in research, and develop systems that help patients in their daily lives. And I think that these experiences gave me a lot of confidence to do that.